Is Heart Health Month. So last week we were talking about almost specifically about the heart, and we're going to continue to do that today, kind of zeroing in on cholesterol. So our guest in house today is Jennifer Blondin, a nurse practitioner with the New Hanover Regional Medical Group, working at the hospital as well. Thank you for stopping by today.
Thank you for having me.
Freshly from Connecticut. Enjoy. This is February, huh?
Yeah, we've got a nice February here.
When it comes to cholesterol, we always hear there's good, there's bad. Do you want to give us the quick, what's the difference between the good and bad?
Yeah, so it's a great question. So you have, your cholesterol is actually carried to the blood with different proteins, and you have two different types. Your bad cholesterol, or your LDL cholesterol, which actually builds up fatty deposits on your artery walls.
And the L, is that the low density, right?
Yep, the low density. And this is bad because that can, the fatty deposits that build up on your arteries can actually lead to heart disease, stroke, peripheral arterial disease, things that we don't want to have.
Yeah. And then your HDL, that's when you're talking like eat your avocados, because it's got
yes,
the HDL.
Your HDL is your healthy cholesterol. So that is good because that actually can help transport some of that LDL or the bad cholesterol back to your liver to be broken down and processed that way.
I didn't know. So that actually works against if you're eating too many fries.
Yep.
That'll actually start to actually aid it back out of your system. I didn't know that.
Yep. So your HDL is very important as well.
When it comes to heart health, and again, with this being Heart Month, how prevalent or how much does our cholesterol factor into things like heart disease and stroke, heart attack, things like this? Because I know cholesterol becomes very much like a hot button topic where people think, well, all right, I've got bad cholesterol, but I don't smoke, I exercise, I do these other things. How important is keeping our cholesterol in check? Keeping
your cholesterol in check is very important. So we tell people to know your numbers. I'm sure a lot of people have heard that before, but really being aware of where you fall versus the normal or goal numbers for your cholesterol. And a lot of what we, you see a lot of patients on medications to help control their cholesterol, but we really also recommend something called TLC, or your therapeutic lifestyle changes, this being weight loss, exercise, diet, because those things are really important in helping drive down that cholesterol as well and bringing up your good cholesterol.
Yeah, and I know, I was put on cholesterol meds a while ago, and I know even just changing your diet can change this significantly. And I saw that within a year, I think, of being put on medicine, where my diet changed and my numbers significantly dropped.
Yeah, definitely. So it's a lot of times we use a combination therapy. But we also, a lot of research is out there showing that if you exercise and improve your diet, you can actually increase your good cholesterol by 10%, up to 10%.
And as far as getting it checked, I know it's a very easy, it's take a little blood, and that's how they figure things out.
Yep, it's a simple blood test, and they routinely start checking at age 20 or greater. Certainly if you have different risk factors or family history, we may be checking more frequently. But it's a very simple test, and it's very important.
Yeah, I can tell you, first, it's nothing scary. It's just look the other way, take what you want, and give me the reading. And you mentioned medicines are out there that can really aid in this. Correct me if I'm wrong, where if you do take it upon yourself, eat right, exercise, those medicines can almost become a thing of the past, correct?
I think that some people may be debatable on that, but I think definitely we want to be starting with those therapeutic lifestyle changes. Certainly if you have different risk factors already, like heart disease, stroke, or diabetes, we'll probably be having you on medication to start with. But exercise, diet, weight loss, those things can all really, really positively influence your cholesterol
It's always
levels.
fun. No matter what the topic is, at its core, what folks who wear the white coat always say, eat right, exercise. It's amazing how it always comes back to those two things.
Yeah.
All right, Jen, we appreciate the time for coming in. Thank you.